Yep.
Anything that's causing this severe pain is very similar to the severe emotional response that something would happen on a battlefield, right? Or the severe emotional response that would happen to somebody who was raped or assaulted or in a severe accident, right? So what's really happening is, anatomically in our brain, there's a problem. So it's not this thing you can control. People feel guilty. So there's too many neurotransmitters in one part of the brain because it's been stimulated so much. The only problem is those neurotransmitters are stimulatory, so it makes the brain run, and metabolically, your nervous system needs to break those neurotransmitters down and clear out that program. It really helps if you stop the brain from running. So when you stop the brain from running, it can metabolically clear those neurotransmitters, and you're no longer in that constant state of hyper excitement. It takes time for things to heal with regenerative medicine a lot of times, but as far as releasing a nerve, that's an instant change. You couldn't use your hand, and now you can use your hand again. You couldn't use your toe, now you can use your toes again. So it's an amazing, rewarding thing to be able to do. There's one of the things that we do that gets that dramatic change also is a stellate ganglion block.
Let's go into that. So, talk about that. I want to know all about that because that's really amazing to me. I remember.
Okay.
Is it the one where you do it right up the nose?
No, you do it. You're blocking the sympathetic chain in the neck in one or two places. And that sympathetic chain, you think of it as that's like the gas pedal to your brain. It's the fight or flight nervous side of your nervous system.
Yes.
So let's say that you had a traumatic experience. A traumatic experience could have been a severe pain to one part of your body.
Okay, like a car accident or something.
Could have been something that happened. What's that?
Like a car accident?
Or a crushing injury, or amputation of a limb, or something like that, or just a chronic pain, a severe pain and nerve impingement.
Yeah.
Anything that's causing this severe pain is very similar to the severe emotional response that something would happen on a battlefield, right? Or the severe emotional response that would happen to somebody who was raped or assaulted or in a severe accident, right? So what's really happening is, anatomically in our brain, there's a problem. So it's not this thing you can control. People feel guilty. So there's too many neurotransmitters in one part of the brain because it's been stimulated so much. The only problem is those neurotransmitters are stimulatory, so it makes the brain run. And metabolically, your nervous system needs to break those neurotransmitters down and clear out that program. But if it's running, it's kind of like if you're running really fast and you're getting a lot of lactic acid in your legs and it's really, really burning, what really helps? To stop running, right?
That sounds reasonable.
Because now I can metabolize that stuff and it works, right? So if you have too many neurotransmitters in the brain, in one part of the brain, and it's creating this movie of an experience that can't shut off, it really helps if you stop the brain from running. So when you stop the brain from running, it can metabolically clear those neurotransmitters, and you're no longer in that constant state of hyper excitement. And that movie, because when people talk about PTSD or pain injuries or fibromyalgia, that movie of whatever that severe pain is just going on and on. So that movie goes away. So that experience of being in that moment and being in the present moment at the same time goes away. So you can just be here, now, efficient. And the longer you're in that state, you may have a movie that's of pain. You may have a movie that's of emotional condition, and it kind of builds on itself. So you're more in your head than you are in the moment. So in that case, you have these typical symptoms. One of the biggest things that happens for an average person is you're more in your head than you are in the moment. It's really hard to hear things. It's really hard to get things done because it's like you have an iPhone with, too many windows open, right?
Right.
You see a little thing spinning on there all the time,
Right.
and it gets really hot and the battery goes down, right? Mm-hmm. So it's working hard, but it's not working well, right? So when we block that push to the brain, we clear those background programs, those background movies. Now we're in the moment, we get more done. So if you're in that stressed out state, you may be in the moment for 10 minutes out of an hour. So compared to somebody who's in the moment 60 minutes in an hour, it takes you 6 times as long to do the same mental functions, right? To do the same work or studying. So how do you compete how does a person with that state compete against another student who's this normal? It's almost impossible. So when we do that block and we change that pain and we take that fight or flight side out of the nervous system, that's a big change. The pain is gone. The emotional response is gone. You can be in the moment. And really being in the moment is what makes life good. So if you have a great experience with somebody or in a place, you want to go back to that experience. And the reason it's so great is because, when you were there, you were all the way there. Right. And if you're not ever all the way there, doesn't matter how great an experience is. It's just like, doesn't matter. I'm not there, because I can't appreciate it. So what's the point, But if you give somebody that reset, that's still a ganglion block, then they can be in the moment. So then you can get the passion in your life back. You get the ability to appreciate life, and you understand this is why I'm alive. Yeah. Life is actually good. Yeah. And I can actually get more stuff done with less effort. Yeah. When we started doing it on the Special Forces guys, the first thing I said, hey, Doc, this is, we feel really good. We feel really relaxed. But, are you taking away our edge? Because, we need our edge to keep us alive, right? We need our edge. It's like, oh, I don't know. So we started testing, and it turns out reflexes get faster, decision-making gets more efficient. Strength goes up, vertical jump goes up, shooting accuracy goes up, just because there's less delay in the nervous system. Your muscles don't get stronger, but you have better control of them. You can make a better decision and execute it more effectively.
Right.
So that's a little bit of the gist of stellate ganglion block. A lot of that time. Go ahead.
Tell me a little bit about the ganglion. What is its function and how does it work, and how does this treatment help that the ganglion? Tell us a little about.
Okay, so what the ganglion does is it regulates your autonomic function. So there's a go and there's a relax. So always think.
Is it parasympathetic, sympathetic?
Sympathetic is go.
Right.
Parasympathetic is relax, right?
Right.
Recover, So, and then a lot of the functions we have are kind of like, do we want more circulation, less circulation? We want a faster heart rate or a slower heart rate? Obviously, sympathetic is going to be an increased heart rate.
Right.
Parasympathetic is going to be, a little bit decreased heart rate. So,
are you saying the ganglion controls the sympathetic and parasympathetic nervous system?
Right. So the ganglion, there's several ganglion, throughout your body. And the closer the ganglion are to the neck, the more they're associated to the brain. So when you block the ganglion, you basically block your sympathetic or your fight or flight side of your nervous system. And that's like the go button. You block the go button.
I got it.
And you really don't need to be on the go button except for maybe like less than 1% of your entire life. So we don't want you on the go button, but if you're on the go button and you need to go, you have nowhere to go up, right? If you're ever in a race, like I'm cruising, I'm comfortable, and then all of a sudden I got somebody, I'm going to beat them, so I have to relax until I'm in a comfortable place that I can sprint fast and I can go up and beat that person, right? Or just be able to have that fire. So if you're already up, you have no up to go, so your performance is down.
Right.
So you're basically taking that sympathetic override off. So sexual function is an issue too, because when in school we used to say, hey, sexual function is point and shoot, right? Yeah. So parasympathetic, point, right? Sympathetic, shoot.
Yeah.
But if your sympathetic is overly stimulated, you might not point as well as you would like, right? Make sense?
Yes.
And you don't have much of a sex drive, right?
No.
So a lot of these guys are in this state where, they're not in the moment enough to hear their wives, and they don't want to have sex with their wives, and they're hyper reacting to everything around them. It's really hard to maintain a relationship when you're in that state. So families will crumble. The reason for the hyperreactivity is that, if you are in a fight or flight state, somebody is trying to kill you or something is trying to kill you, there's only really one appropriate emotional response, and that's a 10 out of 10, 100%, right?
Right.
But if you're walking around your house and there's a sock on the floor and you have a 10 out of 10 emotional response to that sock on the floor, we have a problem.
Mm-hmm.
Yes.
Because everybody around you is now going to walk on eggshells. Because I'd explode for any reason for no control.
Yeah.
Now,
So when you do that block, you get your gradient back. Go ahead.
sorry for the interruption again. To find out more about this speaker, become a speaker on our show, have Dr. Carter present at your event or podcast, learn more about coaching, consulting, tissue allografts, exosomes, supplements, legal help, or how to create $1 million business card and dominate your area, we're here to help you. Just text your name and any question to 561-962-1231. Write that down. That's 561-962-1231. Or go to our website at drrosscarter.com to learn more. On with the show. Okay, so tell me about the procedure of getting that blocked. How long does it last?
Well, it depends on how long somebody's had the issue. Now, it can last anywhere from 3 months to indefinitely. If somebody was a soldier that just got back from a deployment where they had a traumatic experience, it's kind of unusual that they need more than one, honestly.
Okay.
Because they were normal that long ago. Now they're abnormal, and getting them back to normal feels just good, normal. If they've been abnormal for a longer period of time, it may take more work and maybe even some counseling to basically coach them that they're okay being normal. So if somebody was raped, if we get them in the first week, it's not that often we have to do it again. But if it's been years, then, something we may have to work on for a while. The other issue would be if somebody is significantly disabled and then you get them to where they feel pretty normal, that can freak you out too. So they might get pushed back into that state. So I would say it could be up to every 3 months, which is very rare.
Yeah.
Just you only need one.
Yeah.
So it sounds like a great treatment for PTSD. Is that primarily the people you use this for?
I think primarily, for pain, like sympathetic mediated pain, complex regional pain syndrome, and PTSD. Those are the common uses. I think it's just the other secondary use would be performance enhancing overtraining. Because typically when you have an elite athlete that's been overtrained, his heart rate goes up, he gets agitated, he doesn't function as well, his coordination is off. And you can take a few months off and recover, which a lot of times will happen and sometimes won't. Or you can get a stellate block, and the next day, neurologically, you're recovered. Heart rate is down 10 points, vertical jump is up, coordination is up, and then athletes will say, I'm back. So it comes to the point where a lot of these pro athletes, it's pretty much drug-free performance enhancement. There's no drug involved. You're just neurologically refreshed, optimized.
Mm-hmm.
So a lot of these pro athletes will they have every so often when they get over-pushed or overtrained, or also before their biggest event. I really got to win this one. You got to get me before this, so I'm 100% dialed in, neurologically fit. So and the most same thing with athletes. The athletes that overtrain the most, or do the most, or manage the most, some will need every 3 months, but it's kind of rare.
Mm-hmm.
I can only think of two. Most athletes is like once a year, once every 6 months. And it's just a matter of that pushing. I'll give you the example of stellate block that everybody could relate to. I mean, you broke up with your first girlfriend, first girlfriend broke up with you. That'd be the one, right? So I had that happen to me. My girlfriend broke up with me. I was 16 years old, and I talked to my friends, I'm like, you understand, she was the one. It's never going to be the same. We're like, you're going to be fine, Sean. I'm like, no. She was the one. You don't get it. So 6 months later, you asked me how I was doing. I'm like, I'm fine. There's lots of other girls out there, and it's not a problem at all. But I had that traumatic time. You're not performing well in school or athletically because you're just overly pushed. But if you give somebody a block that day, the next day, rather than waiting 6 months, you'd be like, so how do we think about that girl? I'm like, well, she wasn't the right girl for me. There's a lot of other girls out there. Hey, I'm young. I'm going to be awesome. So you just take all of that stress and come away from that divorce, that breakup, whatever that is.
I was going to say, this is great for people that are suffering from a divorce. So this is part of, after when you're starting the process of getting divorced, you need to get a ganglion block, and that way you won't be so reactive. Is that basically it?
Yeah. You won't be in the shock of it all. You'll be able to function. Yeah. So yeah. I had a young.
We're going to make you very popular with divorcees.
Oh yeah. I think it really isn't, but it should be.
Yeah.
I have a young mother that came to me and she said, "Well, your best advertisement should be as my son." I said, "What are you talking about?" She says, "Yeah. I used to yell and scream all the time, and I don't yell and scream all the time. And when my son sees somebody out in public at a store or at school, and their mom's yelling at their kids, they're like, you need to get the shot that my mommy got." My mommy got the shot, and she doesn't do that anymore.
Yeah.
That is great. So now you also do some teaching of different things. Now we talked about hydrodissection as well as the ganglion blocks. Are those procedures that you teach other doctors how to do?
Yes. I work. I teach. Like I said, internationally with a group of people, most notably Tom Clark, Sean Mulvaney, Al Kozar. There's a lot of notable people, but as far as the stellate block, Sean Mulvaney is the most notable. And we helped teach the VA, the first VA, to do stellate blocks. I teach stellate blocks in countries all over the world. Certainly in the United States. I was teaching somebody yesterday. I'll be teaching a bunch of people next week how to do.
You do a group meeting, or how does that work typically? Do you?
Well, there's different ways that I do the teaching, and it's not really part of this business, but one teaching method would be, we have a live model. We teach, we have a little bit of lectures, but we have the expert doctors working with only 4 physicians at a time, because you need that one-on-one, hands-on. So we're going to go through whatever they need on a live model to learn how to diagnose and understand the anatomy. And then, so that's a diagnostic course. We also have then the cadaver courses where we're teaching people how to do those procedures on a cadaver, because they don't scream and you keep stabbing them. They're fine. So an unembalmed cadaver works great. We usually do dissections after that. The other kind of type of course we do is like live patient courses in Mexico. So we go to Mexico, we'll have a government clinic, and a lot of the local people can come in and get treated, and we'll treat maybe 600 procedures over a couple of days. And same thing, 4 doctors, 1 instructor. Instructor will go through and diagnose, walk everybody through it, and walk everybody through how to do a good procedure on that individual. So those are the big class type of courses. Obviously, there's lectures and conventions, and then one-on-one. So we'll go to somebody's office and train them, or we'll go to a hospital and train the local people in the hospital how to do those procedures.
And you offer shadowing as well. Right?
Yeah. Also, people can come into the office here.
See how we do the procedure.
And shadow, it's not free, but come and shadow and just observe how a clinic runs well.